Hello, my name is Pharmacist Michael, and I am a pharmacist board certified in psychiatry and pharmacotherapy. Today, I'm going to talk about catatonia. What is it? Who gets it? What are the symptoms? And how do we treat it? Catatonia is one of those things that I was fascinated with while practicing on the psychiatric unit. So let's start with the definition of catatonia. What is it? Well, catatonia is a condition that can be a part of several mental health disorders, including schizophrenia, bipolar disorder, and depression. It involves a series of unusual behaviors that affect a person's ability to move and react to their environment. Imagine someone stuck in a particular posture, unable to move, speak, or respond to the world around them. That's a glimpse of what catatonia can look like. It's as if the person is trapped within their own body, unable to interact with the outside world in the way they want to. The symptoms of catatonia can range from mild to severe, and can include stupor, where the person might be unresponsive and seem to be in a daze, not reacting to the external environment. Catalepsy, this involves unusual postures. The person might hold a pose for a long time, ignoring gravity and comfort. Waxy flexibility. If someone tries to move the person's arm, it might stay in the new position for a while, like a wax figure. Mutism? That's where the person doesn't speak. Negativism. There's resistance to instructions or attempts to be moved, or the person might do the opposite of what's asked. Agitation? This is not caused by any stimulation or interaction. It just happens. Grimacing, making faces without a clear reason. Echolalia. This is when the person repeats others' words. Sometimes we call this parroting. Echopraxia, which is repeating others' movements. It is important to note that catatonia isn't just being frozen. It can also involve excessive, pointless movement that doesn't seem to have a purpose. The person might mimic sounds or movements they see or hear, echolalia and echopraxia, adding to the complexity of their experience. The reasons behind catatonia are still being studied, but it's known to be linked with disruptions in certain brain pathways that control movement and behavior. Okay, so now that we know what catatonia is, who gets it, and what the symptoms are, let's talk about how we treat these patients. Well, the first thing we need to understand is that there is more than one type of catatonia. We have non-malignant catatonia and malignant catatonia. Malignant catatonia is a very serious and potentially life-threatening condition. It's like an extreme form of catatonia, where the person not only has the usual symptoms, like not being able to move or speak, but also experiences several other severe symptoms. These include having a very high fever, problems with the body's autonomic functions like heartbeat and breathing. This is what doctors mean by autonomic instability. Being in a state of severe confusion or agitation, known as delirium, and having very stiff muscles. This condition needs urgent medical attention to help the person recover. For people with malignant catatonia, which is a very serious condition, doctors first focus on treating whatever health issue is causing it. In addition to this, they use a treatment called electroconvulsive therapy, or ECT, which involves sending small electric currents through the brain under general anesthesia. It sounds intense, but it can be very effective. If the person starts to get better with ECT, the doctors will stop the ECT, but keep treating the original health issue causing the catatonia. If there's no improvement, the doctors will keep going with the ECT, while also doubling down on treating the underlying health problem. For people dealing with non-malignant catatonia, doctors also begin by tackling any underlying health issues. Benzodiazepines, like Lorazepam, are often the first line of treatment when it comes to non-malignant catatonia, and they can even help doctors figure out if catatonia is the right diagnosis. Think of it as a kind of test called the Lorazepam Challenge Test, which helps confirm whether someone has catatonia. Here's how it works. The doctor will look for signs of catatonia in the patient and then give them a small dose of lorazepam, usually 1 or 2 milligrams, directly into their bloodstreams. After about 5 minutes, they check the patient again to see if there's any improvement. If nothing changes, they might give another dose and take another look. A clear sign that the test is positive, meaning it points to catatonia, is if the patient shows a big improvement, like at least a 50% reduction in the symptoms of catatonia after the lorazepam is given. This improvement is usually seen within 10 minutes. If lorazepam is not given through an IV, but is injected into a muscle or taken by mouth, the time before a second dose is given is a bit longer, around 15 to 30 minutes. Many doctors have noticed that this lorazepam test doesn't just help confirm catatonia, it can also bring to light any underlying mental health issues because it allows patients who were previously unable to speak to start talking again. This treatment and test can be incredibly revealing and a big step towards getting the right help. The effectiveness of benzodiazepines in treating catatonia heavily depends on how much is given. Typically, doses can range from 8 to 24 milligrams of lorazepam each day. Surprisingly, these doses can be taken without making the person too sleepy, especially if the amount is gradually increased over time. Most experts recommend starting with a small dose of 1 to 2 milligrams of lorazepam every 4 to 12 hours. The idea is to find just the right amount that helps relieve the symptoms of catatonia without making the person feel overly sedated. Usually, you can expect to see some improvement within 3 to 7 days after starting treatment. It is worth noting that sometimes the improvement can take a bit longer and occur more slowly. When using higher doses of lorazepam, it's crucial to watch out for signs of too much sedation or breathing problems, which means keeping a close eye on the person's response to the medication. While there's still some debate about whether certain benzodiazepines work better for catatonia, lorazepam is often seen as the go-to choice. It has been shown to lead to remission, which means the symptoms improve significantly or disappear in about 79% of cases, making it one of the most frequently used treatments for this condition. The results can be pretty astonishing. I've seen patients who were so affected by their condition that they couldn't speak, but after just a few doses of lorazepam, they started to return to their normal selves. It's truly remarkable. If this approach works and the person starts to get better, doctors can gradually reduce and even stop the lorazepam, all while continuing to address the root cause of the catatonia. If there's no improvement after about a week, the plan might change to include electroconvulsive therapy, which we talked about earlier, which is ECT. The ultimate aim here is full recovery, getting the person back to their usual self without any signs of catatonia. Both the less active, retarded, and more active, excited types of catatonia usually have a good chance of improvement, particularly for those who have conditions like bipolar disorder, depression, or issues caused by toxins or metabolism problems. The more severe form, known as malignant catatonia, can be quite serious, leading to long-term health problems, and in some cases, it has been linked to a risk of death as high as 20%. Catatonia presents a complex challenge in the realm of psychiatric disorders, characterized by a wide spectrum of symptoms ranging from immobility and mutism to excessive purposeless movements. As a board-certified pharmacist in psychiatry and pharmacotherapy, my journey through understanding and treating catatonia has taught me the critical importance of a tailored approach to each patient's unique needs. The distinction between non-malignant and malignant catatonia is crucial, guiding us towards appropriate interventions, from the Lorazepam Challenge Test to potentially life-saving electroconvulsive therapy. The successes I've witnessed, from dramatic responses to benzodiazepines to the transformative effects of ECT, highlight the potential for recovery and the profound impact of our interventions. It's a reminder of the resilience of the human spirit and the power of compassionate, informed care. As we continue to explore the depths of catatonia, our goal remains to unlock the silence, to mobilize the immobile, and to restore the essence of each individual's connection to the world around them. If you have any questions about catatonia or any other disease or disorder, please leave them in the comments section. If you want more information about medications, nutritional supplements, or living a happy, healthy life, subscribe to our channel. My name is Pharmacist Michael. Thank you so much for watching. And as I always say, be happy and be healthy.